A change in the heart's normal electrical conduction system can result in an arrhythmia or irregular heartbeat. An arrhythmia can be an abnormally slow heartbeat or an abnormally fast heartbeat.
Patients with atrial fibrillation who don't respond to medication, heart rhythm doctors use a procedure called catheter ablation to place small burns in the heart's upper chamber to destroy the abnormal electrical circuits that cause it. But the old method has problems.
The old procedure, we used a manual manipulation of the catheter to move it to different parts of the heart.
The procedure could take up to 8 hours and sometimes fail to do the job because manually controlling the catheter movement didn't allow it to get to all abnormal areas. But all that's changed with new technology called stereotaxis.
Stereotaxis allows us to access parts of the heart that we previously couldn't access easily.
Stereotaxis is a robotic-like technology located at the Heart Hospital of New Mexico. Now, after catheters are placed into those upper chambers of the heart, they can be moved with pinpoint precision using robotic technology.
The catheter is controlled by two large magnets. That allows us to manipulate the tip of the magnet and of the catheter, which has a magnet in it, in 360 degrees.
Once the catheter is in the right position, the tissue causing the abnormal rhythm can be burned and safely destroyed. Because of the precision, not only is the procedure shorter, it's more effective and a lot easier on the doctor.
The doctor previously was wearing 40 pounds of lead and standing for up to 6 or 8 hours at a time. And just removing that stress from the job creates a huge amount of safety for the patient because the person is not physically exhausted.
Stereotaxis is being used by the Heart Institute to treat a wide variety of other arrhythmias, faster and with greater precision. With technology like this, Dr. Mazur sees exciting prospects for helping heart patients who couldn't have been helped in the past.
In the same way that General Motors doesn't have humans build cars anymore, we're hoping to get to the point where we can use the technology that General Motors uses to make cars. We can use that technology to fix human beings' hearts.
Had been complaining of all of a sudden getting rapid heart rates.
Paula Knight spent years wondering why her heart felt like it was going to jump out of her chest, but she could never get an answer.
Every time I would come in to see my family physician, the EKGs were all normal. I even wore a heart monitor for a month, and it never happened, so they were never able to get a read on it.
As time wore on, she noticed the rapid heart rate was hitting more frequently and getting worse. So she took action, and just in time.
My son took me to the ER, and I collapsed on the floor in the ER, but they still weren't able to determine what the problem was, but they said, you have to see a cardiologist.
That led her to Dr. Robert Swenson, a cardiologist at the Vancouver Clinic at Southwest Washington Medical Center. Dr. Swenson put a heart monitor on her and within a week identified the problem. Dr. Swenson used catheter ablation therapy to remove that extra connection that was disrupting the timing of the electrical signals through her heart.
The little electrical fibers most often run just under the inside surface of the heart, so we can set the catheter adjacent to that area, apply a small amount of heat just into that one very localized region, and safely knock out those short-circuiting fibers.
There's actually incisions around your femoral arteries, and they thread some tiny needles up into your heart, and your heart has to cooperate. They basically, I believe, shot me up with some kind of adrenaline to try to get my heart to do what was wrong, and it cooperated. It happened, and Dr. Swenson was able to fix it.
A few hours in the hospital, and Paula was cured.
I think I came back a week or so, maybe less later for my post-op, and then to hear Dr. Swenson say, well, I don't need to see you anymore. It's done. It's over with. You will never get this again. And that made me very happy.
Not only did the procedure help fix Paula's racing heart, it also helped her get in the race just weeks afterward. Wayne Garcia, the